Okay.
What other?
So this is a woman who came in. You can see from her pictures here before that she had large thighs. It was a real problem. She couldn't wear pants. They were always too big in the waist. She was frustrated. It wasn't going away. You look at her after picture, you can see both in the front and the back, her shape looks great. It's normal. And that's what she wanted to be. Now she can wear anything. You know, this is not just for women. So let me show you what we do for men.
Okay.
So here's a guy. He's young. He's going to the gym. But you know what? He's got fullness in his chest. He's got sort of a pudgy tummy. And, you know, he wants to look great. And Randy, when I look at him, I can see, okay, I'm going to take a little bit off his chest here, a little bit in his love hand, a little bit in his tummy. It's a sculpting. And I can see what he's going to look like. He's going to look great. He's going to look like he wants to look. Look at the after. And what do you see? He's got a six-pack.
Yeah, he looks in shape.
Not every guy's going to have a six-pack.
Right.
But his skin is tight. He's youthful. He's young. He's got great muscles. You see it. So that's what I imagine he would look like. And you can see he's got no love handles. He's got great definition. He looks buff. That's what all guys want to look like that. Don't you want to look like that?
Yeah, it looks good.
Right? So it really made a difference. But it's not how much you take out. It's not that everyone should do it. It's the artistry of being able to see, okay, I know what you need to get where you want to go. Now, if you can do that with a short recovery, yeah, that's like great.
Do you think that, because look, people that are watching this, most people agree, like we said before, that if you're over 30, if you're over 40, for sure, you have a couple of inches you could pinch, right? Mm-hmm. And most of these people would love to get lipo or get rid of that fat, but the downtime. So do you think that the people realized how good this can be as far as low downtime, they could drive themselves home, that they would do it? I mean, are there that many people that don't like the fat on their abdomen where you are?
Yeah, there are. Look, I'm in North Carolina. We have a lot of people that don't like the fat on their tummy, but that's true of all over the country.
Yeah.
But yeah, I think there are a lot of people. If you ask most people, would you take care of that? The first question they're going to ask you is, well, what's my recovery? So if you have a quick recovery, but you don't get the result, or you don't get the result for a couple of months, or the result is very minimal, it's not what you want. You want to go from where you are to where you want to be. Now, you're asking me, can you do that predictably? The answer is yeah, you can.
Okay, good. What areas of the body do you do?
So,
starting from the top, going down.
Okay, for men and women, neck, tummy, back. For women, the bra roll. That's an area women hate because the bra presses, there's fullness on the top and the bottom.
Is that a common area?
Very common, very, very common. And you can see in some of these results, you know, that is nice and smooth on the back. The hips, the thighs, the inner thighs, knees.
What about arms?
Arms are great. You know, for you and me, we're wearing shirts, it's okay. You wear a jacket, it's okay. What if you're wearing a sleeveless top and you're a woman?
Yeah.
Right? What if you want to wear a certain top? You can't do it. So here's a woman who came to me and said, okay, I hate my arms. I'm not wearing certain clothes because of my arms. Okay. I said, here's a procedure where we can do a procedure called circumferential arm shaping. And what that means is that with this technique, I can do the liposuction differently than I did it before. It's different. The cannulas, the tubes I'm using to do the job are smaller, they're more delicate, so I can get the skin. You'll see on that line in this picture, you can see that from before to after, her skin has contracted. You'd think, oh, you need laser. You don't need laser. So it is how it's done, but more important than anything else is she had a quick recovery. She's great. And you know what? So I should have done this years ago. More patients come in and say, I should have done this years ago.
We literally are out of time.
Randy, let me show you a few quick...
Okay, 2 minutes, 2 minutes.
Let me show you some results here. So Randy, here's a woman that came to me. She had 2 children. She said, I don't want a tummy tuck. What can you do for me? And you see her result. Her tummy is so different. She's in a bathing suit. She's happy. That's where she wanted to be. Here's a guy, great shape, but now he's got his sculpted abs, right? Here's a guy, man boobs, right?
Oh, boy.
Right? Totally limiting. You see before, after, he's great. Here's a woman who is short, right? She just had this full figure. Okay, afterwards, she's got shape, and she's ecstatic. So here's another patient. You can see in her before, she's she's frustrated with her tummy. She doesn't have the shape. After, she's got a nice, shapely, athletic abdomen. What I want to show you is what I do with the fat instead of just throwing it away, because now